Hi, it's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I actually published a podcast with one of our clients with a testimonial and a case study. And the case study was all about, my sister had a heart attack and sustained a brain injury. Is this the end of life for her? You can check out last week's podcast by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer questions from one of my clients as part of my one-on-one consulting and advocacy services. And this is a more general question today from one of our clients, but it's a question that we get all the time. And the question today is, what is sepsis? So sepsis is the body's extreme response to an infection. It's a life-threatening medical emergency. Sepsis happens when an infection you already have in your skin, lungs, urinary tract, or somewhere else, often in the blood as well, triggers a chain reaction through your body. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. Severe cases of sepsis can lead to septic shock, which is a medical emergency. Anyone can get sepsis, but the risk, generally speaking, is higher in people with weakened immune systems. It's also higher in infants and children, as well as the elderly. Also in people with chronic illnesses such as diabetes, AIDS, HIV, cancer and kidney or liver disease. And also people suffering from a severe burns or physical trauma. So what are the symptoms of sepsis? There are 3 stages of sepsis: sepsis, severe sepsis, and septic shock. Sepsis can happen while you're still in the hospital recovering from a procedure, but this isn't always the case. So what are the symptoms of sepsis? Number 1, a fever above 101 degrees Fahrenheit or 38 degrees Celsius, or a temperature below 96.8 Fahrenheit or 36 degrees Celsius. A heart rate higher than 90 beats per minute. A breathing rate higher than 20 breaths per minute, as well as probable or confirmed infection. So what are the signs of severe sepsis? Patches of discolored skin, decreased urination, changes in mental ability, low platelet counts. Low platelets are the blood clotting cells. Problems in breathing, abnormal heart functions, chills due to fall in body temperature, unconsciousness, extreme weakness. So what are the symptoms of a septic shock? Symptoms of septic shock include the symptoms of severe sepsis plus a very low blood pressure. Conventional hemodynamic monitoring in septic shock pertains to invasive, mostly continuous measurements of arterial blood pressure and pressures in the lesser circulation, central venous, pulmonary arterial and capillary wedge pressures, and to intermittent determinations of cardiac output. In order to obtain the latter variables, insertion of a thermistor balloon-tipped pulmonary artery catheter is required. So what causes sepsis? Number 1, pneumonia. Number 2, abdominal infection, kidney infection, bloodstream infection. Possible reasons for the increase of incidence of sepsis include an aging population because sepsis is more common in seniors, an increase in antibiotic resistance, which happens when an antibiotic loses its ability to resist or kill bacteria, an increase in the number of people with illnesses that weaken their immune systems. So which people are at risk for sepsis? Although some people have a higher risk of infection, anyone can get sepsis. People who are at risk include young children and seniors, people with weaker immune systems, such as those with HIV or those in chemotherapy treatment for cancer, people being treated in an intensive care unit or ICU, people exposed to invasive devices such as intravenous catheters or breathing tubes. How is sepsis diagnosed? If you have symptoms of sepsis, your doctor will order tests to make a diagnosis and determine the severity of your infection. One of the first tests is a blood test. Your blood is checked for complications like infection, clotting problems, abnormal liver or kidney function, decreased amount of oxygen, an imbalance in minerals called electrolytes that affect the amount of water in your body as well as the acidity of your blood. Depending on your symptoms and the results of your blood test, your doctor may order other tests, including a urine test to check for bacteria in your urine, a wound secretion test to check an open wound for infection, a mucus secretion test to identify germs responsible for an infection. If your doctor can't determine the source of an infection using the above tests, they may order an internal view of your body using one of the following: X-rays to view the lungs or abdominal parts, CT scans to view possible infections in the appendix, pancreas or bowel area, but also lungs again, ultrasounds to view infections in the gallbladder or ovaries, MRI scans which can identify soft tissue infections. So how is sepsis treated? Sepsis can quickly progress to septic shock and death if it's left untreated. Doctors use a number of medications to treat sepsis, including but not limited to antibiotics via IVs to fight infections, inotropes or vasopressors, and other vasoactive medications to increase blood pressure, insulin to stabilize blood sugar, steroids to reduce inflammation, painkillers. Severe sepsis may also require large amounts of intravenous fluids and a respirator or ventilator for breathing. Hemodialysis might be necessary if the kidneys are failing. Kidneys help filter harmful wastes, salt and excess water from the blood. In hemodialysis, a machine performs these functions. In some cases, surgery may be needed to remove the source of an infection. This includes draining a pus-filled abscess or removing infected tissue. Next, sepsis prevention. Taking steps to prevent the spread of infection can reduce your risk of developing sepsis. These include staying up to date on your vaccinations. Get vaccinated for the flu, pneumonia, and other infections. Next, practice good hygiene. This means practicing proper wound care, hand washing, and bathing regularly. Getting immediate care if you develop signs of infection. Every minute counts when it comes to sepsis treatment. The sooner you get treatment, the better the outcome. You can also check the references for this article and video below this video in the written version of this blog, or if you're watching this on YouTube, just click on the link below this video. That'll get you to our website. where you can read the blog post and also see the references. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly, whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone or via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.